Hello HPEP students, how you guys doing today? I'm Dr. McGee. As you guys know, I'm the founder of Pop on Youth Violence, and this is our summer health professional enrichment program, which is now virtual. So right now we're at South Lake Emergency Department. This is the back of the ambulance bay where all the patients who are really sick come in through the ambulance. This is one of our vehicles that just came in. And by the way, if you look right there, that's our COVID testing site for patients who may have COVID. Follow me to the ambulance bay. I want to give you an experience of looking inside of an actual ambulance. Come forward. As you can see, this is where the patients have their stretcher. And this is where the paramedics are, and they're working on the patients. All the equipment and everything are all in here. If patients rapidly decline, they can be intubated, they can be shocked, and they can be taken care of right away. So oftentimes, once they're taken care of, they'll come in here, and this is coming into the ER. So let's say if that patient was a cardiac arrest patient. They actually come in here and go right to this ambulance trauma bay. Come on in, guys. So this is the trauma bay, okay? This is where critical patients come. If they have a heart attack, if we're delivering a baby, if it's a bad car accident, if it's somebody who's been shot or stabbed, somebody who's not doing well, somebody who's in respiratory distress and needs to be intubated, this is where it all goes down. This is our trauma bay. Again, this is Methodist Hospital South Lake. I'm Dr. McGee, and I'm giving you a virtual tour through our ER so you can see what to expect when you're here on August 4th through the 7th, where we're having our health professionals enrichment program for minority students who are interested in becoming doctors, dentists, nurses, nurse practitioners, physician assistants from both Northwest Indiana and Chicago. So come on, let's go. This is our ER. This is just more rooms, okay? This is another trauma bay. It's another trauma bay right here. There's the same things in here as well. We can actually, if we have more than one sick critical patient, we can also use this space as well. These are more additional rooms. Okay. Again, these are just our normal size rooms here at Methodist Hospital. All right? All right, we're going to take you to the main ER now. This is one of our paramedics who was just driving that ambulance I just showed you. Tell about some of the things that you do as a paramedic.
We basically are doctors and nurses in the field. We bring them here for further treatment and do the best to take care of them in the field and get them here safely and so they can get further treatment here at Methodist.
So these guys, we couldn't be here without them. They take care of all the critical patients who can't get to the hospital quickly enough via car or if they don't have transportation. And the beauty of someone calling an ambulance or a fireman or paramedic at home is that they can start treatment right away. As I showed you on the rig, they have medicines, they have equipment. If someone's having an asthma attack, you can get treatment. If someone's been shot or stabbed, they can be intubated with a ventilator and their life can be saved. And so we need them a lot. So always give thanks to your paramedics. Thank you, guys.
Always.
All right, so we're walking through the rest of the ER right now. As you can see to the right, these are more rooms. I'm gonna come over this way. This is the area where the nurses are, okay? These are more rooms. So I wanna take you to something, I wanna show you something. This is Sam, one of our environmentalist specialists. We can't do it without Sam. Sam's been here for 50 years, right, Sam?
How about 32?
32 years. He's about to retire soon. We love that guy. Keeps the place clean. When we have patients who are ill with COVID, he has to go in the room and clean real well so that other people can get infected. And so right now, I'm just gonna show you kind of like how we prepare for patients who have COVID. We have extra PPE equipment, which is what we put on. In addition to that, we will wear a helmet as well for additional protection. Okay? So now, I'm going to show you a COVID room. As you can see, this is the outside layer. The patients in there are in isolation, and we have negative pressure so that the bacteria, the virus cannot get out to infect more patients. So we have several of these rooms. And so right now COVID is alive and present, and we're doing our best to get rid of it. And so we treat all kinds of patients, and at this time we're going to go ahead and end the tour.